Here in rural Oregon and in communities across North America, we're reversing the downward trend and learning how to truly live well. We're coming together around a culture of well-being. And it's not due to some new expensive drug or medical procedure. There's a beauty and the simplicity of what I want to share with you. Little, practical, simple changes that lead to positive transformation. I get to work alongside my community, organizations, and the most dedicated volunteers, directing community-wide well-being initiatives that are impacting people. I'll never forget when Frank popped into our office downtown. He was wearing his fast food uniform, and yet he told me about how his stage 4 kidney disease had reversed, and how his pants went from a size 48 to 44. He spoke to me like we were old friends, but I didn't know Frank. Never met him, but he sought us out because he wanted to let us know that our work was making an impact. I'd met Jane a few times and was there when she told others about how her type 2 diabetes disappeared and her cholesterol cut in half. A colleague told me about Danita and how she could now move around the house and yard without taking a break every 10 minutes. Desmond emailed me recently about how his PTSD and depression feel improved. Maria, I know well, and was thrilled when she told me that her fibromyalgia spasm had gone away and haven't come back. And these are just a few stories of personal well-being transformation, like so many others that I've seen with my own eyes or just heard about right in my own town. For the various teams I've had the privilege of working with to create and further a culture of well-being, these are the stories that feed and energize us. As challenging as it is rewarding, this work pushes me beyond my real and perceived barriers and pulls from every experience and learning I've had thus far. We're endeavoring to transform communities, to challenge the health destiny of areas that are on a trajectory to be riddled with sickness. In communities like mine, everyone knows someone who's suffering from heart disease, diabetes, obesity. Our family members, our neighbors, the person next to us at church or at the grocery store checkout stand, where our children follow in the same footsteps, and where stents and dialysis are the norm. Chronic illnesses are often readily apparent in small rural communities, and we are no exception. The 2018 Community Health Assessment showed that the residents of Douglas County, Oregon, the rural county where I live, have higher rates of chronic diseases than Oregon overall. Nearly 60% of our adults have one or more chronic condition, and a third are considered not overweight, but obese. According to the ShareCare Wellbeing Index, since 2016, 86% of US states have declined in well-being. And Robert Wood Johnson's county health rankings show that among rural counties like mine, more are worsening than improving. And this is one of the reasons that well-being fascinates me with its complexities and multi-layers. When talking about well-being, many people immediately think of diet and exercise, which are critical, and having basic needs met like shelter, clean water, food, and safety are necessary to provide the space of mind to think about those kinds of things and beyond. Earlier in life, I was on track with the professional goals I had at the time, really wanting to make a difference, be the change, using avenues like government, creating after-school programs and community gardens, social work, seeing kids that would come to class and sit with their head down the whole time, people that would come to our resume building workshops with alcohol on their breath, seeing bill after bill crafted in response to a deluge of constituent feedback and industry lobbyists. Overwhelmed, I felt I didn't have enough to give to the strangers I encountered, to clients, to friends and family, to my boss. Each interaction tested me to bring something or not. But my aspirations to have an impact required more. To explore this, I I took an opportunity that seemed like quite the swerve from my track to honor this nagging desire to have more to give. I put myself in a completely different environment, conducive to holistic well-being, with opportunities for introspection, natural movement, healthy food, alongside people of diverse backgrounds and ages. This was important for my journey, to develop some personal well-being practices that keep me going today, to respect service in community as a way of life, and to see what it was like to have the healthy choice as the easy choice. Because in contrast, what we see is that when it's all on the individual, willpower cannot withstand a world of temptation, where healthy choices are inconvenient, bland, expensive, or even dangerous. Moments of weakness, loneliness, depression can make even the most well-intentioned, resilient person follow the path of least resistance, either by driving instead of walking or biking, or by reaching for whatever version of salt, sugar, or fat strikes their fancy, or by not reaching at all, not using their gifts, or fulfilling their life's purpose. Community-wide transformation requires a cultural shift, inclusive to all, with each person making an impact in ways that are accessible to them, and then creating a ripple effect. Working together to make good nutrition and exercise easy, but also on healthy relationships, building community in neighborhoods, exploring purposeful lives, reversing patterns of exploitation and trauma, and enriching the narrative through authentic inclusivity. Community building seems to demand genuine, trusting relationships with people of all backgrounds, which can be really hard sometimes. Members of our high-functioning, resilient teams have experienced institutional racism and violence, come from families where English is a second language, or have come out of extreme trauma and poverty. We're giving our hearts to this work, investing in every kind of person, making efforts to see through the package and into their worth, appreciating their struggle and resilience, even when in another situation, we might be the object of their prejudice. What at times seems like radical inclusivity is enabling us to connect more broadly for the greater objective of trying to thrive together. And at times, these authentic, maybe unlikely connections can be incredibly fulfilling. So my little swerve and deviation from my track brought about a positive, holistic change in me, and ended up being 7 years to learn how to create a culture of well-being and be a person that can connect with and lead people of all backgrounds. I had to start with myself. Even though I initially resisted, I later saw how a shift in environment can be important. I found myself volunteering for a small, budding, grassroots organization developed to support people that are interested in improving their well-being through lifestyle and fundamental things like eating more plants, connecting with community, and growing gardens. Just as I had experienced earlier in my personal life, I saw how others could also initially resist and then break through and embrace positive change. How one person could take their struggle, coupled with resilience, and contribute to a culture of well-being. Started by a single mom wanting to build community for her son with small plant-based potlucks, and now a vibrant, credible pillar in our community, I jumped in headfirst in the organization's early years, participating as much as I could, and became exposed to and fell in love with community health transformation. At this time, I was desperate to keep living on purpose and willing to sacrifice comfort for the nimble, effective, and palpable impact I felt through volunteering. Later, I learned about the research that shows that volunteers live longer, like the longitudinal study of aging and others that show that volunteers are less susceptible to depression, experience lower mortality rates, and have better mental and physical health overall. The more I learned, the more excited I became about the impact we could each have. I learned about the spectrum of community transformation interventions and the different approaches to behavior change, from the use of social norms to changing policy and the physical environment, to fiscal disincentives and even eliminating and creating choice. I heard about the work of the Buettners and National Geographic in recognizing the places around the world where people are living the longest, healthiest lives, rich with connection and reward. Blue Zones, the world's longevity hotspots where indigenous wisdom and practices have resulted in people living to age 100 about 10 times more than the average person living in the US. And these outcomes don't happen by accident. There are thousands of human-made interventions that can further disparity and inequity or nudge individuals toward greater well-being. With over 50 communities across North America that are implementing the research and well-being best practices found in the world's Blue Zones, we see that the longevity of the longest living populations in the world is something that any community can work toward. Well-being practices that are universally applicable. I mean, these things can be recreated by regular old community members in regular old places around any town. Locally, we're meeting people where they're at, with a healthy shopping tour at their local grocery store, workshops on finding purpose at the local library, walking groups and cooking classes hosted at the church or senior center in their neighborhood, giving communities an opportunity to volunteer together and experience the reward of having an impact on projects that are important to them. Fixing bikes and providing bike and pedestrian education for children and parents. Bringing produce into convenience stores in food deserts, or more accurately, food apartheids, where residents have to ride the bus for hours to get to fresh food otherwise. Remember Frank? This is how he was impacted. He gained easy and direct access to fresh food in his neighborhood. We started a produce prescription program so that providers can refer patients to farmers markets instead of pharmacies. The results of the 2018 Share Care Wellbeing Index showed that the community members engaged in our local wellbeing initiative were less overweight and obese and experienced high cholesterol less than their unengaged counterparts. When engaged, they exercised more and ate more produce. These are simple but meaningful changes in a rural community after just a few years of intervention. Earlier, I mentioned that shifts in the environment can be important, taking the onus off the individual and making healthy choices easier, like making it safe and inviting to move about and spend time outdoors. We worked with our largest employers to introduce strategies like making sure cafeterias have affordable, healthy food always available. We're taking micro breaks and drinking water is encouraged. We're connecting with coworkers. Purpose and being known are important parts of the workplace culture. And where children and ex-smokers can walk down the street without being exposed to smoke. Real change across sectors. And this kind of work can start with one inspired individual, then two, and ripple out from there until a tipping point is reached. Every encounter offers the possibility of another person touched and then casting ripples out in their own micro-communities. I run into people around town and even outside of my community constantly that have been touched by this work, some of whom I've never met before, like Frank, who shares his successes with his fast food coworkers, the political party he volunteers with, and neighbors. If I can reach several hundred people a year, and they subsequently influence their networks, we're creating something big, giving people permission to make now the time to transform their well-being. to dust off the bike, to dig into the garden, to quit smoking for good, to eat a little healthier, to start living on purpose, to put down the cell phone and pick up the instrument, or to walk instead of drive, and to find where they can lead by serving. So what would this look like in your community? Take a moment to imagine if more and more people started investing in their well-being, taking healthy behaviors at every level, from the fringe to the norm, and creating a strong culture of well-being. I invite you to join me in trying to do this every moment you can, for yourself, for greater longevity and a vibrant, purposeful life. But also, that could mean someone else gets inspired. I've shared with you about my efforts to bring about change, and I hope that these examples can just make this accessible to each of you, because you can impact your community. And you don't have to have a 7-year swerve or be this passionate to do this. Your community needs you to do this. Your loved ones need you to do this. You can do it now. None of us can do it all or alone. But there's power in simple practices. Model gratitude daily. Invite a neighbor to go for a walk. Smile at, greet, and listen to people that are different from you, making efforts to see their struggle and inherent worth. But if that's too hard, then grow food and give some away. Find your purpose in this life and make that the reason you get up in the morning. Find love for yourself and give that to others. And stay open to learning and growing. You can't get through a single day without having an impact on the world around you. What you do makes a difference, and you have to decide what kind of difference you want to make. We give one another permission to do these things by leading by example, and may never know who we're impacting until we meet our Frank. I want you to meet your Frank. You're never going to see the real Frank in this slideshow. But Frank can be anyone. Maybe you've been Frank, or maybe you're yet to meet them. That person may be a stranger whose whole life has been impacted by some action, big or small, that you were a part of. Because only together can we create a vibrant and thriving community.